So this video is to show you how to do a wet to dry dressing change. These are used in healthcare when there's some sort of wound healing problem, issue, and we're trying to bring new tissue into the wound. Now, for example, if you look at the quality of medical gauzes, I have two different types here. You may need to come in pretty tightly. This is the type you're going to need. Notice how it has what I'll call a fine waffle pattern. So the more that we open it up, you'll see that the waffles get more and more visible. I'm going to call that a waffle pattern. That's crucial. You might go to the drugstore or what have you and buy this kind of gauze, and sadly that's just not going to work. So if you get this type of gauze, it's not going to do the job. You have to have the one with the little waffle pattern. So the next thing we're going to do is we're going to wet a little bit of the gauze, hence the term wet to dry dressing. You could do this over a sink or something. I'm just trying to make it so you can see everything on the video. Okay, so now you have a little bit of gauze. It's obviously pretty wet in that little zone there. So we're gonna cut a little piece. Okay, so once again, the crucial element is those fine little waffles. Can you see those on the video? Okay, so let's pretend that the wound is inside this red rectangle. So we're gonna put the waffles into the rectangle and maybe get a couple different layers of the waffle pattern. You wanna kind of press it into the raw tissue because this is how eventually you're gonna bring more living tissue to the area. So that's like our third. So it's like 3 layers of the waffle. And again, this is a pretend wound, but if there was a wound inside that red rectangle. Here you could probably go to like a beauty supply store, get a fine tweezer, maybe like a manicure scissors, something like that. And you would trim away. If you're older, like your surgeon, get a pair of readers or something so you do it really accurately. So then trim away the extra gauze. If there was actual wound here, it'd be sticking a little better. I have to do a little bit of Hollywood pretend here. Okay, so we would continue to kind of work those waffles so they really are in the wound. Then we would simply take a dry piece of gauze, hence the term wet to dry dressing. We would take a dry piece of gauze, kind of put it over the wet gauze, and then you could take a little bandage tape or first aid tape. You could obviously. Okay, so then this would be taped on, and you'd wear this for maybe 4 to 6 hours. And then what happens is you take off the dry, the wet one will have dried out, and those little tiny waffles will go into the base of that wound, pretend wound for the video, and when you lift this off, it'll take some debris with it, some of the tissue debris. And that lifting off, as this will have dried in the several intervening hours, as that lifts off, the kind of yucky, unhealthy tissue tends to come off in the gauze, and then your body starts to get chemically motivated to form new tissue, and it might look a little bit red. Sometimes in healthcare we say beefy red, and that's the granulation tissue growing in. Then again, pretend it's been 4 to 6 hours later. You take another piece of gauze, obviously a fresh one, you wouldn't reuse it. You put it back into the wound. You put a dry gauze on top of everything, and you just repeat that about every 6 to 8 hours. And doing that wet to dry dressing change on this pretend wound in real life will bring new tissue where you need it to be. And it'll take maybe 3 to 6 weeks, but that tissue will kind of fill in, and then you'll have your best possible healed tissue in that area.